Good evening, everyone. So good to see you all here tonight. Thank you so much for taking time out of your evening to come and be with us. I'm Tazeen Ahmed. I'm the president of the Women's Democratic Club. And thank you for joining us today to hear about the Early Child Care and Education in Maryland Funding the Possibilities seminar that we're holding. In Maryland, as elsewhere, early care and education is increasingly scarce and expensive. On average, families in Maryland are spending 21% of their income on childcare, as compared to 13% nationwide. Early care and education investment enables children, families, and businesses to flourish. At WDC, we see this as public good and deserving of robust public discussion. And we have a fantastic panel here for you tonight. So before I hand it over to our tonight's moderator, I just want to talk a little bit about WDC for those of you who do not know about us. Though I think most of you already know that WDC works to keep our members informed, connected, and politically effective. We've been around for decades, and we run a wide range of events, including community speaker series, community education panels like we're doing today. We also do state and county advocacy, candidate forums, happy hours with a purpose like the one we did earlier this month with Fred Yang, and get out the vote efforts. WDC is a membership organization, so we rely on your dues, which is really only $35 a year, to help us put on a wide range of programs. But we also rely on your donations to provide many of those programs at no cost to attendees. So please remember to renew your membership. And if you're members already, we really feel it's important for you to consider volunteering your time, attending our events, engaging in our advocacy, and sharing information about our work on important issues. We invite you to join one of our committees to help amplify our voices on issues at both Annapolis and the county level. And you can find a list of our committees on our website, the womensdemocraticclub.org. If you're not a member, please consider joining. We'd love to have you. The final event on our calendar for this year is our members-only holiday party, which will be Sunday on December 15th from 4 to 6 in Potomac. Registration is required, but you can find a link to register on our website, and it will be a great opportunity to reconnect, reflect, and hear from elected officials and community leaders about what 2025 and beyond looks like. And I know many of us are very concerned about what that is going to look like for us. This will be an all-member event, but we welcome new members, so please share this information with your friends and family, and we look forward to having you there. I would like to, at this point, I'm going to keep this brief because we have this amazing panel, and I'm going to hand it over to our co-chair of the Children and Youth Subcommittee, Kate Stein, and she's going to get us started for the rest of the evening. Thank you.
Great. Thank you, Tazeen. And thank you all for joining. I think this is going to be a great conversation. And in part, it's going to be a great conversation because we've got a great moderator. We are joined this evening by Maya Laura, who is the early childhood education reporter for the Baltimore Sun. She is one of my go-tos for information about early childhood in Maryland, and the Sun is one of my go-tos for all things state and local. So great reporter, great publication. Maya previously covered DE&I, diversity, equity, and inclusion for the Sun, and prior to joining the Sun, covered business and politics in South and Central Florida. She holds a bachelor's degree from Washington and Lee University. And I'm going to go ahead and pass it off to Maya.
Hi, everyone. Thank you so much for having me. I actually just realized that I did not catch a typo in my slide. I'm actually at the Baltimore Banner. I used to be at the Baltimore Sun, but I'm at the Baltimore Banner today, and like Kate said, I cover early childhood education. I am part of a 5-person education team over at the Baltimore Banner, which is a nonprofit newsroom, and we added early childhood education to our list of coverage just this year. So it's been a lot of learning, and it's been really exciting. And I have a ton of great panelists joining me tonight. Our first panel is going to be on the current state of early childhood education. And our first panelist is Danny DiPietro, who is the Policy Research Director for the Office of the Comptroller of Maryland. Previously, she was the Legislative Director and Chief of Staff for Brooke Lierman during her second term as a delegate. She's worked for nonprofits based in India and Louisiana, focusing on improving public health outcomes and advancing equity. And she holds a bachelor's degree in public health from Tulane University and a master's in public policy from American University. Our second panelist is Christina Push, who is the Executive Director of the Maryland State Child Care Association. She is the co-chair of the MSDE Office of Child Care Advisory Council and governor appointee on Maryland State Early Childhood Advisory Council. She has spent more than 20 years leading the nonprofit early childhood education organizations, child care, early learning program. She's worked as a preschool teacher, director of child care programs, and was the regional coordinator for 6 nonprofit early care and education programs across Maryland. And she's active at the local, state, and federal levels, including Maryland Trauma Informed Care Commission, the Maryland Family Engagement Coalition, the Early Childhood Research Advisory Council, and Abilities Network Advisory Council. And rounding out our first panel is Jennifer Arnaiz, who has spent more than 35 years in early care and education, from the classroom to leadership, drawing on her Latino roots and understanding of community needs. She is a recognized advocate at the local, state, and national levels, focusing on equity, workforce development, and quality improvement in childcare. She leads Montgomery County's Early Child Care and Education Initiative, overseeing operational policies and managing multiple grants that support diverse early care needs. And her expertise includes strategic planning, grant management, and fostering collaborative community partnerships, earning her respect as a collaborator and advocate for equity in childcare. So have a really incredible panel stacked with experts, and they're each going to tell all of you a little bit about their organizations and what they do before we jump into the panel.
Should I jump in now? Okay, perfect. Thanks, Maya, for the introduction. Good evening, everyone. So as Maya said, I'm Danny DePietro. I am part of a team at that the comptroller created when she first took office just about 2 years ago now, to support her on the big statewide fiscal boards that she sits on, and to monitor and report on economic trends in a way that's hopefully helpful to the public and policymakers. So I'm just going to take a few short minutes to explain why I'm here, since I might seem like the odd one out on this panel. So if you can go to the next slide, that'd be great. As you may have seen, in January of this year, our team, in partnership with the Board of Revenue Estimates, published the first ever State of the Economy report. And it revealed stagnant economic growth in Maryland since about 2016 and identified 2 key drivers of the stagnant growth. The first was slowing population growth in Maryland, and the second was a depressed labor force participation rate in Maryland since the pandemic. And that's the percent of the population who are employed or actively looking for work. So over the past 11 months, since the State of the Economy report came out, we've been working on a series of follow-up policy briefs that more closely examine these population and labor force trends. And we're currently working on one, the second in the series, that looks at the role of childcare in Maryland's labor force and the economy, hence why I'm here. Next slide, please. So why focus on labor force participation? Because addressing the barriers that keep Marylanders from working is critical to our economic growth, which is something we care a lot about at the Comptroller's Office. This figure shows labor force participation rates for Maryland, represented by the red line, and our neighbors and the US. And as you'll see, all represented here experienced a drop at the onset of the pandemic, but then the other states started recovering within a year or so, while Maryland's labor force participation rate has been relatively stagnant. So we're still about 4 percentage points below where we were pre-pandemic, where other states have either met or exceeded their pre-pandemic levels. So what does that mean? A lower labor force participation rate, next slide, means that in Maryland translates to a smaller labor pool, so fewer workers, making it harder for businesses to expand or grow. Expand or open. So this figure shows that in Maryland, again represented by the red line, there are nearly 2 job openings for every job seeker. While in the US, the yellow line, that ratio is about 1 to 1. So there's a lot of job vacancies. Like I said, that affects businesses, and it also affects workers, because fewer workers engaged in the economy can lead to lower household incomes, of course, and lower state tax revenues. So when we look at who's on the sidelines in Maryland, we see that it is more so women. Next slide, please. And even more so women with young children. And women here represented by the red line. This is their labor force participation rate, and men with the yellow line. Some of the reasons are related to demographic and industry shifts, including an aging population and skills mismatches. But another reason is increased challenges caring for young children. So in summary, in that final slide, in this report, we take a look at national data on this topic. So peer-reviewed literature establishing the connection between childcare accessibility and women's labor force participation rate. We also look at state level data on the number of childcare providers, the number of workers, and statewide childcare capacity. And then finally, we did a lot of qualitative research talking to providers, workers, nonprofit associations, and advocates like Chris's, chambers of commerce, employers, economists. And we're really excited to be working on this with the Department of Labor, and should be coming out, this report, at the end of the year. So that's me. Thank you.
Great. And now we'll hear from Chris.
Great, thank you. I'm Chris Push, Executive Director of the Maryland State Child Care Association. We're a nonprofit 501c3 celebrating 40 years in business this year. And we are an organization that represents childcare providers, the workforce of over 6,000 members that we have that are licensed professional programs, learning centers in our state, and we work for the advancement and advocacy of them and for best practice for children. And we develop a priorities agenda every year. We work on different advocacy types of opportunities, but what we focus on are these 4 areas. So first and foremost, childcare is an economic and equity imperative, and we're going to talk more about that this evening. So for our priorities agenda, we focus on the Blueprint for Maryland's Future and Pillar 1 and the equity related to that, which includes the ability for us for universal pre-K. MSCCA continues to advocate for the community-based programs, including family child care, center-based child care, religious programs, to ensure that state leaders recognize the supports for quality birth to 5 learning in each of these settings through proportionate funding and equity. We also advocate for Maryland families. First and foremost, MSCCA believes that the most equitable and efficient way to expand access to quality childcare in the state of Maryland is through direct family investments. And so these investments include scholarships, the Childcare Scholarship Program, refundable tax credits, and these supports will help address affordability and accessibility issues for Maryland families. And we know that access to quality, affordable childcare leads to better outcomes for Maryland's youngest citizens. We also, our priorities agenda includes reducing early childhood workforce barriers and addressing the critical workforce shortages, which Danny's touched on a bit. And so we continue to advocate for early childhood businesses to find ways to make it easier for them to recruit and retain a qualified workforce. Part of this process requires regulatory agencies address unfunded mandates, overzealous employment requirements, and antiquated systems that all lead to hurdles to the recruitment and retention process for Maryland's early childhood programs, and MSCCA leads the charge in this area. And we also work to identify strategies to improve compensation and workforce development. And as tuition-dependent businesses, we cannot adequately increase tuition enough to support a worthy wage for our Maryland early childhood workforce. Doing so would make it childcare unaffordable for families. We advocate for improvements in other funding supports so that businesses can raise teacher pay, build capacity, and develop the workforce. And so next slide, please. Sorry.
We have to actually end it there to move on to our next
Sure.
point. But we'll get back to all this during the discussion for sure.
Great, perfect.
Good evening, everyone. So Jennifer Arnaiz, I'm the Administrator for Early Childhood Services, part of Montgomery County's Department of Health and Human Services. And within my portfolio, I oversee all programs and services that the county oversees for children birth to 5. Our program specifically serves 3 core areas in this space of early childhood education. We provide comprehensive services where we are directly engaging with families as well as providers in childcare, providing mental health supports, parenting education, early intervention, as well as early childhood. We also support childcare programs, either through quality enhancements, obtaining licensure, meeting licensure requirements, as well as obtaining higher quality credentials and benchmarks, such as accreditation or our state rating improvement system, Maryland Excels. We also have a core support of business counseling to our childcare providers so that they can optimize the work that they're doing. And lastly, we also oversee economic supports, whether this is through tuition assistance and subsidy to funds allocated for pursuing credentialing and accreditation, as well as scholarships to further their continuing education for either certifications or pursuing higher ed. We're very pleased about the work that we do. We are spread out throughout Montgomery County. Our staff is highly diverse to reflect the citizens with or residents within our jurisdiction, being able to serve individuals in various languages. Within our, I would say the largest pocket of support that we have is the support that we give to our early care and education programs, our child care providers. We do this through direct interaction, through mentoring, coaching, and training, technical assistance, and such. A lot of the work that we do also intersects with our early care and education initiative. We are a jurisdiction that is now in our 6th year of having an initiative where we have a collective of public agencies, the public schools, the community college, and county government who come together to organize our services so that we can actually do our best work by maximizing the resources that are within each agency as we work within the space of early care and education. Our ultimate goal is that our collaboration together will help to strengthen the foundation for our children and our families in our jurisdiction.
Great. Well, thank you all so much for introducing what you do so wonderfully. And now we're going to move into our first panel. And my first question, I'm just going to throw it to all of the panelists and have them each answer. And I want to start by just getting everybody on the same page. So when we talk about early childhood education, a lot of people kind of boil that down to just daycare where you drop your kid off during the day. But I think all of us here know that early childhood education encompasses so many more services than what we traditionally think of as daycare. And so I wanted to start by having each of you talk about what you think should be part of the conversation when we talk about early childhood education. What gets left out that everybody should be thinking about?
I can start. So Montgomery County has just completed 2 important studies. We're the only jurisdiction that has completed a cost of quality childcare as well as the supply and demand. And those 2 studies really elevated some core concerns within this space. So what is forgotten in this space of early care and education, right, is some of the things that we know, right? Childcare is expensive for families, but it's also expensive for the childcare provider. The actual cost to operate per seat exceeds the market rate that parents are paying. And so we have an industry that's really built on the backs of low wages for our staff so that we can offer programs that are really subsidizing this entire industry, right? And it's pretty unfortunate. We also have learned that there are significant barriers or acts to access and participation in the childcare space. And one of those is that there is a significant shortage of seats for infants and toddlers. A lot of the focus is on preschool. And based on our supply and demand study, we have found that only about 19% of the actual population of infants and toddlers is being can be served in Montgomery County, whereas 69% is being served for preschool. So when we look at infants and toddlers and what we were talking about before, women going back into the workforce, right? Where am I going to leave my baby? So my precious treasure for the day while I'm at work, where will that be? It's really hard to find those seats. And if I find it, can I afford it?
And I'll piggyback off of Jennifer to state that really we would need to understand a number of things that early childhood education begins at birth and is a continuum to age 8, and that 90% of a child's brain is developed before the age of 5, and only 10% after. And I think this is an important tenet that we need to keep as our focus because early childhood experiences help to quality early childhood experience help to provide significant, important outcomes for our children later in life. And additionally, childcare is an economic driver, which Danny can talk more about. It's part of the economy. Childcare is the workforce behind the workforce. So connecting the dots between the brain development, the importance of the access and affordability for our workforce, and also childcare impacts everyone directly and indirectly. So if you don't have children that are of this age, or they're grown, or you know, anybody that has childcare impacts everyone, because if you go to work and your coworker doesn't show up because they don't have a consistent childcare, that puts a burden on that business and that service. If you know anything to do with the services that you get, or directly and indirectly, this is childcare. So I think we're not really connecting the dots on how important those early experiences are and how it's connected to pretty much everything. And it's an equity imperative and an economic imperative. So I think we need to spend a little more time in looking at the full comprehensive components of childcare and early childhood education.
I'll definitely piggyback on a few things that were said, and obviously I'm newer to this topic, so defer to the experts, but the things that have stuck out to me in doing this research, first I'll just highlight absolutely to what Chris said, this is not just a women's issue, and that's really, you know, a huge part of the reason we wanted to do this research, to make clear to the public and policymakers really how much impact a healthy, you know, affordable, accessible childcare system can have on labor force participation, increased productivity of workers, state revenues. You know, we all are tracking our revenue estimates and the budget outlook, and it's just all connected. Increased economic security for families, and thinking about, you know, the ability for someone to work. Obviously, that's an income, but it's also usually in the US access to benefits like health insurance and retirement savings. And then if we think about that for single mothers or single parents, and how much, you know, even more important that is, since they can't be accessed, you know, those benefits through a spouse or another earner. And then also we're thinking a lot about and seeing in the data the increased earning potential for women, and how much, you know, especially as we think about the wage gap, and trying to address that, you know, this can just compound it so much more if women are dropping out of the labor force. You know, even if they're reentering, there's usually a long-term sort of hit to earnings potentials. The other thing I'll say is also to piggyback on sort of the equity implications, and I think it's been really interesting to study the shifts within the provision of childcare. So, you know, what's happening to family care versus centers, and what that means for accessibility based on geography and price, and sort of preference for type of care. So there's just so much that's been fascinating, and the business model for sure is the last thing I'll say. The first thing I did when we decided to research this was read a U.S. Treasury report that said on average, you know, childcare providers are making less than 1% in margins, and on average have about 3 months of cash on hand, and that has really stuck with me as we think about how fragile, you know, this industry really is, and yeah.
Yeah, so Danny, with everything that you just said and what you started to talk about at the end of your presentation, I know that you've been working on that big report that you mentioned. The Comptroller's office has been really looking closely at those post-pandemic numbers for childcare. And so I was hoping that you could kind of give us a summary of the post-pandemic accessibility and affordability landscape here in Maryland, and how we compare to some of our closest neighbors in closing all of the gaps that we've seen since the pandemic closed a lot of that traditional family care.
Yeah, I won't get into too much detail just since the report isn't out yet, but essentially, I think the high level takeaway is that on the whole, Maryland is wrapped up in some national trends for sure. I think there's only 3 states out of the 37 that childcare aware tracks that have actually increased the number of family care providers since the pandemic. So most states are losing family care providers, so are we. Maybe at a faster rate than the average state, but it's not like we're a total anomaly. Similar for centers, most states took a hit at the beginning of the pandemic. And I think what's interesting in Maryland is I think our recovery has just been slower, which when we think about our overall labor force recovery, I think there's probably a connection there. It's been harder for us to get workers back, and those are childcare workers too. So, we're tracking national trends, but in some cases moving sort of quicker in a downward direction or just slower to recover. And that's the high level.
Great. And I know, as we said in our, initial kind of summary of this conversation, pre-K is certainly not the only thing that we want to be looking at when it comes to childcare, but it is a huge topic of conversation. It's where the state has thrown a lot of its muscle behind, is expanding pre-K. And so, Christina, I wanted to check in with you because I know that you talk to providers all of the time. And there's been a huge struggle to get private providers to expand into the state's pre-K expansion. And so I was hoping that you could talk about what changes have really made a difference so far in the blueprint adjustments, and what would really continue to make a difference as we head into the next General Assembly session if we were to make more adjustments to blueprint to make this a more equitable system for the private providers to get involved.
Great question, Maya. Yes, so we have made some advancements. The will of the state, or the blueprint itself in Pillar 1, is looking to a mixed delivery system that includes community-based providers as well as the public schools. And the goal is to have a minimum 50-50 split of the mixed delivery of private providers and public schools. And we, even at a 90-10 split, we have not been able to do that in Maryland. None of the jurisdictions have been able to do that. And one of the numerous reasons that the childcare providers are not coming to the table, some are not aware of what is going on, but it's important that they are, because without our 3s and 4s, we cannot sustain our businesses. So there is no business model for childcare without 3s and 4s. So if the state were to take our 3s and 4s into all public schools, we would close many more childcare programs, and there would be a huge workforce issue and an impact to the economy. But so the awareness is part of it, but a big part of the reason that they aren't able to come to the table was the barriers around the teacher qualifications that are required to participate as a public mixed deliverer, as well as the amount of funding per slot per child wasn't enough because they're not able to pay the wages necessary, because you have to have a certain amount of children in order to break even. So if you're a center, you'd have to have at least 8 to 10 children that meet the criteria for the eligibility for public pre-K. And the criteria in our state is still at the 300% of the federal poverty level, or a child that's ELL, or family that English isn't their first language, or a child that may have special needs or homelessness. And so if you're in a catchment area, whether it's Montgomery County or throughout the state, and you don't have enough children to offset the cost of paying a teacher commensurate for what public school salaries are, then it's not worth our effort to come to the table to participate. And so we've been able to make some strides related to the teacher qualifications. In the last 2 legislative sessions, we had passed House Bill 1219 2 sessions ago, led by the Ways and Means Committee, and it was the Education Workforce Shortage Act, where we were able to take out the certification component for the lead teacher. And that was really helpful, because we were having to do practicums and outside of our own businesses, and losing revenue that way. And you shouldn't have to close your business to participate in this. And also that a lot of people didn't have certifications in early childhood. So we were able to move from that. And then this session, we were able to pass House Bill 1441, which has been extremely helpful in looking at those barriers and alternative pathways, which include experiential learning, competencies. And so our lead teachers have some other pathways that are not one-dimensional. And so it doesn't decrease quality, but it's more expansive to what the workforce looks like. And hopefully that will help to bring more providers and businesses to the table to participate. The bill also increased and expedited the amount of funding that is supposed to be available. I know we could talk about the budget, and Danny might want to do that, but we are looking at, there's a lot of money, as you said, Maya, thrown behind this, but we are supposed to be rolling out a sliding scale in the state up to 600% of the federal poverty level. So that would include a lot more families and children that would be eligible for free public pre-K. And so one of the things that we've done is the funding was only $10,000. That went up to $13,000 per child. And next year it goes up a little bit more. So as you roll out the sliding scale, they expedited in 1441 the scale so that it is at a higher level, and that we will get to more funding per slot that will help offset the costs necessary to participate. So we have made some great strides. There is more work to do. As you said, there is some policy changes that could be made in Maryland Excels. There are application issues. So I don't want to take up all the time, but there are some things that we're looking forward to and making some changes in this session that I think will be also helpful to an equity lens in
Maya,
delivery.
I'm sorry, can everyone please mute yourselves if you are not one of the panelists or Maya? Thank you very much.
We have 1 minute, and I was wondering if I could throw a question out.
Well, I wanted to get a question to Jennifer.
Okay.
And so, Jennifer, sorry,
Hey.
somebody's still unmuted.
Yeah. Everyone, you can, whoever has the comm can mute everyone.
And Jennifer, I wanted to make sure I got to ask you about this before we close up. I know that you're passionate about the growing opportunities for family child care program. And so I wanted to give you a chance to talk about why it's so important to add more family child care specifically to the market when we're talking about addressing child care gaps.
So in 2015, we initiated and launched our Growing Opportunities in Family Childcare, GO FCC, in Montgomery County. And it really was to address the shortage of family childcare. Montgomery County is one of the most diverse jurisdictions in the state of Maryland. And we found that there were many families that were, for parent choice, were choosing to find either friends or family to care for their children. So in an effort to be able to create more childcare seats in the community in environments that were culturally respectful to the families, we launched Go FCC. And it really is a two-part initiative that focuses on not just the regulatory pieces that are required to obtain a family child care registration, but also to provide the business support and counseling so that women, typically Black and Brown women in our jurisdictions, could actually become entrepreneurs and contribute to their communities. So as I said, it started in 2015, and it took a slight turn in 2017. We were able to then really formalize our approach. It's a very systematic cohort that individuals participate in. We leverage county dollars so that we can be able to support with the purchase of equipment for the homes, provide one-on-one coaching and counseling for both business and pedagogy, provide all the training in both Spanish and in English. And then we were really excited because then the state looked at our model and took it to the next level and wanted to branch it out across the state of Maryland. Montgomery County, we have led this initiative, and one of the important pieces or aspects of this is once an individual obtains their registration and opens up the seats, and so family childcare has about 8 seats per home, is then to take it to the next step, which is really about empowerment of quality enhancement, accreditation, excels, and then paying it forward, really becoming advocates. So this empowerment project is really about taking individuals into entrepreneurship and then leading them into leadership roles within their own community.
Great, thank you for that. I think that is the end of our first panel, but I do think we have some time at the very end for additional Q&A. So if you had a question for one of our panelists, you can still hold on to that. And we'll be moving into our second panel now, which is on policy. And I'm going to be joined by Albert Watt, who is the Senior Policy Director at the Alliance for Early Success, where he supports the organization's strategy and goals for early education, including increasing access to high-quality pre-K and childcare, improving the early learning workforce, and enhancing alignment with K-12 policies. Previously, he was the Senior Policy Analyst in the Education Division of the National Governors Association Center for Best Practices, where he focused on early care and education policies from early childhood through third grade, and as research manager at Pre-K Now, an advocacy campaign at the Pew Center on the States. He's also served on 2 National Academies committees focused on children, and he serves on the board of the Council for Professional Recognition. And then also joining me for the second panel is Anna Lovejoy, who is the Director of Early Childhood Policy at the Center for American Progress. Previously, she was the Senior Associate and Program Director at the Center for the Study of Social Policy, where she oversaw the education on best practices for engaging families in Head Start, early Head Start, and childcare programs, definitely relevant today. Directed work as consortium partner at the National Center on Parent, Family, and Community Engagement, served as a program director for early childhood education at the National Governors Association, where she provided technical assistance and policy guidance to governors and their early childhood policy advisors, and she holds a Bachelor of Arts in Politics from Princeton University. So I want to welcome both of them to the panel, and I'll start with Albert, who's going to tell you a little bit about his organization.
Great, thank you for having me. I live in DC. I'm a DC resident, so it's nice to do something at the local level. So the Alliance for Early Success, we've been around for almost 20 years. You see the mission on this slide. We're really, at our core, we're a community of state advocates and national policy organizations that are working together to advance early childhood policies and investments at the state level. And in terms of early childhood issues, what we mean by that is really, we're really interested in a broad range of early childhood issues, early care education, things like childcare, preschool, but also health issues, whether it's maternal health, infant health, access to healthcare services, social and emotional health, et cetera. And then also family support issues that could include economic supports like tax credits and paid family leave, but also things like home visiting and other policies that support the well-being of the family unit. We do this in really one of 3 ways. The first is that we're not a foundation, but we raise money from foundations at the national level that are interested in investing in this type of work. And we grant that out to a network of state advocacy organizations who are doing the work on the ground in all 50 states and the District of Columbia. Another thing that we do is we invest in a network of what we call responsive support organizations at the national level and consultants with the express purpose of connecting their expertise and their resources to the state advocacy organizations that we fund so that they can be as effective as they can be doing what they do. And the final thing that we do is we facilitate a lot of peer-to-peer connections and learning opportunities across our network so that, again, people can learn from each other. Each state is different, but a lot of times states can learn from each other and kind of adopt their different ideas into their own context. So, we do this by, everything informally, from informal kind of connections that we make through phone calls and Zoom calls, emails, but also we have peer learning communities and communities of practice that we meet with on a regular basis. And then we have annual meetings that bring these folks together in person and do more peer-to-peer connection that way. So I'll stop there and look forward to the conversation.
Thanks. And then I'll let Anna introduce a little bit of what she does.
Yeah, hi. Thank you for having me. It's great to be here tonight. So I, as Maya mentioned, I'm the Director of Early Childhood Policy at the Center for American Progress, which is an independent, nonpartisan policy institute that is dedicated to improving the lives of all Americans through bold, progressive ideas, as well as strong leadership and concerted action. And our aim is not to just change the conversation, but to change the country. And you can go to the next slide. So here on the early childhood team, we're committed to advancing progressive policies with bold, family-friendly solutions that equitably support all children, families, and early educators. And then my role on the team is to monitor and report on state policy trends, identifying proof points of what works to inform federal policy, and to share best practices across states. So that's my contact information. Feel free to get in touch with me if you have any questions following up on this event. Thank you.
Great. Thank you both for introducing what you do. And I'm going to start this panel by kind of immediately going into a rapid fire question for our two experts. And so I wanted to know what each of you think is the most important policy at the state level and then at the federal level that would expand equitable access to early childhood education. Where should everyone be focusing the most energy if they had to pick one?
Anna, do you want to start?
Sure, I'd be happy to. And I'm going to be a contentious panelist and say that I can't only pick one, because I think this issue really there are sort of two ways to go about it. One is addressing affordability. As we mentioned, childcare is so expensive for families that we really need to do something to bring that price down. But at the same time, we need to ensure that there's sufficient supply because as we were discussing earlier, providers are not paid what they deserve to be paid. And we're losing, particularly family childcare homes, but we're losing, too many providers. So I think the best approach is to address both affordability by, for instance, making eligibility for childcare subsidies, raising the eligibility threshold to above 85% of the state median income, and also providing wage supplements and other forms of compensation directly to providers in order to make sure that we have sufficient supply.
So I agree a lot with what Anna said. I think I would add is how I would talk about this is that I think as a system, we need to be funding childcare by looking at what it costs to actually deliver quality services, as opposed to what we've been doing for a long time is to use what we call market rate, which is basically what a community, what parents can afford to pay, which, as you can tell by that, like it just bakes in a lot of inequities within that, in terms of if you're providing a low-income community, your rate is going to be lower than other places. So if we switch to the cost of quality so that we can look at, really be thoughtful about, what is it that it takes financially to deliver quality services. And I think, at the top of that list would be the workforce, right? We need very qualified people to do this work, and they need to be paid, at least a living wage, if not, a more competitive wage, compared to public education teachers, for example. So we can do those things and then fund it. And I think that's the other thing, is that we need to actually find the revenue, find the funding to pay, to support the system. There are things that we can do to work within what we have right now. We can braid and we can, and blend funding streams. But I think at the end of the day, this really does require additional revenue, whether this both, I wouldn't say whether, but both at the state and federal level, to make this work. And I know you have another panel later on, we'll talk about revenue. So I'll leave it at that. But I think those are the two important pieces I would focus on.
Great. And then Albert, because your work looks, at states across the country, what are some policies that you've seen work in other states that you think would yield the best results here in Maryland? And keeping in mind that piece you just mentioned, funding, as I'm sure you know, Maryland is staring down a pretty large deficit. It's only going to grow. So how do we get those policies to work, even though we have a lot of funding challenges here in the state?
Yeah, so I think the first thing I would say is that start to have those conversations about revenue. It's never too early, because this is a lot, these revenue advocacy is a long-term kind of effort, and so if you don't have the conversation, you'll never get there. So I would suggest that people start having those conversations where you're going to find revenue. Outside of that, I think what I would say is that within a tight budget environment, I think I would look at some of the things that we talked about earlier about, for example, lowering burden on providers, right? So we can think about things in terms of family childcare provider, which I know is a big priority for Maryland. Think about whether there are barriers to family childcare providers, like, in some states, they have regulations that treat these homes as businesses rather than residences. So which means that sometimes they have to like install a really big, like, fire extinguisher system with things like that. Or they allow local districts to impose additional requirements on family childcare providers beyond the state licensing requirements. And so some states have gotten rid of that. And then in DC, for example, like they've passed laws that prohibit condo associations and other associations to prohibit tenants and owners from operating. And so there are things like that that you can lower the burden on how providers are operating. I think the other thing is this might require a little bit more resources, but during the pandemic, there are a lot of efforts to stabilize how the business model of childcare providers. So moving to, and then Maryland might have done these things. I didn't do the research to find out, but moving to things like requiring or moving, paying providers by enrollment, not by attendance, and to do more prospective payments instead of doing reimbursements, using more grants and contracts. These are all things that can allow providers to, be more, have a stronger base of getting the revenue, how to get the revenue in so that they can operate a more stable business, so that they can, serve communities, more effectively and maybe even expand in the future. So.
Great. And a quick follow-up, are there any states that you would hold up as a model for like, this is the best way to do it that Maryland could kind of look to for inspiration?
Well, I mean, I think, and I'm sure Anna can add to this. I think those states that people are looking to these days, I think New Mexico is one of them. And so, and they have, been able to raise revenue. They have expanded eligibility. They're now working on workforce compensation and haven't cracked the nut of, of compensation yet, but they're working on it. So I think New Mexico is, one place that people are looking at. And DC too. DC has, again, both in those cases, they have been able to raise revenue. So I know that's not always a near-term possibility, but again, that's really going to be important, important conversation to start right now.
Yeah, and I'm sure we'll talk about all of that in the funding panel. And I have another question for you, but before we move on, is there anything you wanted to add to that conversation about what states you would really hold as models, or any policies you think would work particularly well in Maryland?
Yeah, I'll address both of those quickly. One is a trend that we're seeing across several states following Kentucky's lead, which is making childcare workers eligible for childcare subsidies. So that's a way to recruit and retain childcare employees into businesses, childcare businesses, as a way to improve supply. So that's one trend that's relatively low cost. I mean, it does cost something, but it's proven to be somewhat effective. And then the other thing I would mention in terms of states, Vermont is another state that comes to mind. They passed a payroll tax to fund the ability of the state to raise eligibility to up to 575% of the federal poverty level for childcare subsidies, and also provide wage supplements to providers. So again, they're getting at that both sides of the coin, trying to get affordability, but also supply up in the state. And then I would also say Massachusetts and Minnesota are also doing things along those lines. So those are a couple of other states that we're keeping an eye on.
Great. And you mentioned, legislation that makes childcare providers eligible for childcare subsidies. I think that's something that is going to get considered here in Maryland in this next session. And so I wanted to ask you, how do you feel about that as an overall policy, using subsidies as a way to address costs? Because it doesn't bring the cost down, it just brings like the individual cost for a family down if they qualify. So how do we think about subsidies as a long-term solution? Are they a long-term solution, or are they a stopgap?
No, I think that can be a long-term solution. I think it just depends on how high you set that eligibility level, and in terms of how many families you can reach. The other issue is that if you only address the affordability equation, you may end up increasing demand without addressing that supply issue again. So, I think that's just a caution that I would offer. if you're going to pursue that route.
Yeah, and forgive me if you said this earlier in your answer, but do you have a sense of where eligibility should be? Like how, I think you said 85% of state median income. Like, why is that the number? Does it need to be that high? Like, walk me through the reasoning for that number.
Yeah, so that's a federal limit on being able to use federal dollars to pay for childcare subsidies. States can go higher than that, as a couple of states have done, but they have to use their own general funds or another source of revenue for that. So that's where that comes from.
And can I just add that one of our national partners, Committee for Economic Development, has been working with some of our state partners to develop these childcare affordability calculators. So it allows and they have to develop it for local like counties as well. They allow the county or state to understand at what point is childcare fund, cost so high that it really gonna get into sort of cut into the kind of the sustenance and livelihood of families. And so that can help people understand at what point we might want to expand eligibility to, so that families can access childcare and also provide for all the other things that they need as a family. And of course, there are states that actually are going for universal childcare in the long term. So they're actually pushing for childcare for everybody. In some cases, even no co-pays. New York and Oregon are two that are again, that's a very long-term goal, but they're putting that out there and getting people to kind of understand why that might be necessary.
That's actually a great segue into my next question for both of you, which is a little bit of a philosophical question, but I think it's an important underpinning of the way that we're starting to talk about childcare, which is how do we get legislators and even regular voters, particularly regular everyday citizens who don't have children, to start to see early child education as an investment and not just a cost that parents should have to shoulder? How do we get people to believe that this is something everyone should be pouring into the way that we did years ago through K through 12 education?
I can start, and Albert, you can follow up. Yeah, I think the economic argument that like Danny was talking about in the previous panel, just showing the importance of childcare as the workforce behind the workforce. As I think someone else mentioned, that it's so important to the health of the economy that impacts all of us, not just families. I think is one important argument that we can make, and we can do a better job of getting the message out there on that.
Yeah, I think that's right, and just kind of helping people connect the dots of like what it would mean for a family, whether in whatever income level, to be able to afford childcare, whether that means that they can use some of the money to like spend on other things and stimulate the economy that way, or they can go to work, or I think there are downstream effects that we can kind of do more to kind of paint the picture, or make it more concrete for people to understand. And I think at the end of the day, it's if you want to appeal to more of a sort of political framing, I would say this is about choice, right? I mean, choice in the sense of like giving families, not just women, but families, the choice of like, do we want to, want one parent to stay at home? Do we want one parent or both parents to work? And what kind of, arrangement do we want for our own family? And I think, having access to high quality, affordable childcare is really about giving families all those choices that they can have.
Great. I think we have probably 20 seconds left, which is not enough time for a good question. So I'm going to wrap it there. But thank you both so much for joining me. And you can DM questions for either of them for the end after our third and last panel, which is on funding. And for that panel, I am going to be joined first by Bruno Showers, Bruno is the state policy manager for the Children's Funding Project. He supports the organization's capacity to analyze state level revenue options to fund children's programs. Previously, he was the senior policy analyst at Arkansas Advocates for Children and Families, where he led the organization's advocacy efforts related to state tax and budget policies, as well as programs that support family economic security. He has more than a decade of experience in the nonprofit and public sector, including the Arkansas Department of Human Services, the Arkansas Public Policy Panel, and the Center on Budget and Policy Priorities. He has a Bachelor of Arts in Liberal Arts and a Master's in Public Administration from the University of Arkansas at Little Rock. I will also be joined by Ashley Brooks, who is the Senior Research Associate at the Children's Funding Project. She supports research capacity team by tracking, analyzing, and disseminating actionable information about policies and resources that communities invest in young people. Prior to her current job, she worked at the Forum for Youth Investment as the executive assistant to former CEO Karen Pittman, and then as a program associate for the Big Picture Approach team. She supported the partnership work at the Forum and was a member of the Readiness Projects, which is a partnership between the Forum for Youth Investment, the National Urban League, and the American Institutes for Research to use science-informed strategies to upend inequity. She's a Maryland native and graduated from the University of Maryland College Park in May 2019 with a Bachelor's of Arts in History. And our last panelist is Britt Anna Skovich. I hope I did that right. I did ask for the panel. She has more than 30 years of experience as a child advocate at the local, state, and national levels in youth and community development, child welfare, and systems reform. She's currently the strategic public financing coordinator who maps and analyzes public and private financial investments in early care and education, estimates the true costs of designing and implementing new programs, strategies, and policy priorities, and assesses the feasibility for securing new funding. She previously managed the USAID-funded maternal and child health initiatives in Africa and Asia, and brings diverse experience in youth, community change, child welfare initiatives, and children's funding and service innovation across the Annie E. Casey Foundation, the Forum for Youth Investment and the Finance Project, and the Stoneleaf Foundation. She has led a large Philadelphia-based child welfare agency. So those are our panelists for our last conversation on funding, and I'm going to let them tell you a little bit about their organizations and what they do.
You want me to start? Sure. Hey, everyone. Bruno Showers, as mentioned. Children's Funding Project helps organizations, communities do what's called strategic public financing, which briefly is the process of figuring out how much you're spending on your early care and education system, then figuring out how much it would cost to get where you want to go with your early care and education system. And then my job here specifically is to help you figure out, once you have that number, where's that revenue going to come from? And in particular, I work with states, although I'll try, if there's interest, to talk about some local and federal policy today as well. So kind of from what I'm hearing from the other panelists, echoes a lot of what I'm hearing nationally in other states as well. But you know, the concerns that we're hearing, whether it's affordability for families, whether it's sustainability and profitability for providers, or whether it's wages for workers so that they don't need to be paid less than they could make at like McDonald's in some cases, literally. Really what we're looking at is that we need more revenue, we need more money. And I can tell you from experience and looking across the country that it's going to have to come from a public source, which means ultimately it's going to come from taxes. I think that that's something that obviously in the context of Maryland and is a problem because of the budget deficit that's been mentioned. I think from what I understand, things are okay between now and 2027, but then some choices need to be made about revenue or cuts. And then kind of an additional concern is the federal backdrop, which hasn't been discussed too much here, but the new administration, Congress is really going to be under pressure to extend the Tax Cuts and Jobs Act and potentially enact, further cuts, which puts pressure on our federal budget. It may not lead to direct cuts in your services, but it makes it harder for them to grow. And so I think The good thing is that Albert mentioned that the conversations need to be started. I know that people have been having this conversation in Maryland. There's something called the Fair Share Maryland, which has a plan that would, from my understanding, fill the gap, at least in the short to medium term. Their plan would include several revenue raisers, which perhaps we can get into once we kind of in the panel and discussing some questions about funding and where the revenue is going to come from.
Yeah, Bruna, I'm sorry, I have to end you a little bit right there so we can get the other panelists introduced, but we can definitely touch on all of that. And I'll go ahead and let Ashley introduce herself.
Perfect. Thank you, Maya. Hi, everyone. It's great to be here with you all. I work alongside Bruno at the Children's Funding Project. My work there primarily is on fiscal mapping, which I wanted to just briefly talk about with you all. So what is a fiscal map? It's really a tool that helps to understand how much money is currently being invested and into what. And so if you wouldn't mind going to the next slide. This is our infamous spaghetti slide here. And so this answers really two. Well, why do we need to make these fiscal maps? On the left, this is how budget professionals, people in the state departments, they really view their budgets, the programs, the dollar amounts. That's how their view. On the right, this is how families and children are really navigating all of these different public services and trying to make sense of it. So really, we make these fiscal maps to try to make sense of both of these together and to show how much money is currently being invested into specific services that people are able to understand and easily digest. So I'm currently right now working on this fiscal map for the state of Maryland. It will include for all ages 0 to 24. And then we are also, this is mandated by Governor Moore and his Enough Act to do this fiscal mapping process as well for all of the counties as well as Baltimore City. So we're doing this work right now with the Governor's Office of Children. They have a state children's financing coordinator, Chelsea De Jesus, who is really working alongside that work. There's a lot of eyes and attention on Maryland right now. It's a very ambitious, but very exciting, and excited to be here with you all to talk about it today.
Thank you. And then Britt can go ahead and introduce the work that she does.
Great. Thank you so much. Great to be here with everyone today. Thanks for having me. So I am the Strategic Public Financing Coordinator with Children's Opportunity Alliance, and we are a public-private nonprofit organization. We were legislatively established in 2022, and we are Montgomery County's early care and education coordinating entity. Our mission is to connect our community to build an equitable, accessible, high quality, and sustainable early childhood system that narrows disparities and puts all young children on a path to their greatest potential. Next slide, please. So effectively serving children at scale in Montgomery County is a big challenge due to its size and diverse population. There are 74,000 children ages 5 and younger, and more than half are not kindergarten ready. And also more than half are living below the self-sufficiency standard. Next slide, please. So this year we completed our first fiscal map. I'm so glad that Ashley and Bruno went first. They actually coached me on this process. And what we did is research and track federal, state, and local, as well as private investments in our early childhood system. And our greatest finding, not a surprise, it's a very complex and fragmented system with multiple decision makers, and it's extremely, extremely expensive, with the burden falling overwhelmingly on parents. And while we identified more than $640 million, this is largely parents shouldering 65% of all funding through tuition payments. And then despite roughly $220 million in public investments, this is not nearly enough to meet the need, as everyone has said earlier. For context, only 10% of income eligible families receive childcare subsidies that help defray the tuition costs. Again, that's only 10% of income eligible families. So there's a crucial need for private funding as well. However, you could see here, philanthropic funding is only 1% of the investments overall. Next slide, please. So this is hard to read, probably. It's a lot of next steps that we're focusing on in Montgomery County. And really, I'll just say that we're setting some shared priorities across the system. We're engaging our stakeholders. We're having listening sessions. We're looking at what those priorities will be. And we're trying to make some cost estimations. We're not ready to share exactly yet, but our partners, the Early Care and Education Initiative with Jennifer here, as well as other partners like the school system. We're just looking at how much it would cost to fund this system. We're at the very earliest stages of investigating how to increase revenues. And we're learning from other places around the country successfully doing this. And last slide, please. This is how you can reach us, stay in touch, and thank you so much.
Great. Well, with that, we're going to move right into the panel. Thank you guys for introducing all of the great work that you do, teaching people about fiscal maps. And I wanted to start the panel kind of in the same vein that I ended the last panel, which keeping in mind that Maryland is facing a pretty tough fiscal position as a state going into this next General Assembly session. Everyone's talking about where is the money going to come from. With that kind of as the backdrop, how do you envision convincing people that funding early childhood education should be a priority at the state and local level, given everything else that still needs to get paid for? And that's for the whole panel, so anybody can just jump in.
I'll take a first crack at it. I guess I would say that our experience is that it is popular enough to gain support when it's taken to voters, right? So the thing that I'm thinking of is, for instance, Washington just voted, the state, not DC, voted to retain their capital gains tax, which goes to both K-12, but also early education. I know at the local level, we were watching some ballot initiatives like in Austin, where voters voted to raise their own property taxes to fund early care and education. So I think people are convinced of this when they're presented the option. So that's my thought on that, or at least my first thought on that.
I think too, to add to that, Maya, so the fiscal maps that we'll be doing for Maryland for the counties, they'll be looking at 5 years of data. So backtracking prior to the pandemic, 2019 through 2023. And I know there's already this big deficit that's coming, but also the fiscal map is going to be really interesting. You're going to be able to see these like one-time big investments that we saw into childcare and into the workforce, and they were great. I will say Maryland, I saw a lot more investments than I have seen in other places, but again, they're one time. And so this fiscal map, I think, is going to be really transparent into the lack of funding, the funding that's currently there that's going to disappear. And really, we think of these tools as a lot of just tools for advocates to have these numbers back of hand, to be able to say and make comparisons. We've done this across the country. We're up to almost 20 different states that we have done these fiscal maps for, able to like do different comparisons and say, well, these states are doing this. And so really just want to make these tools so that people do have this knowledge and the power in the back of their hand as well when they're making these arguments, Maya.
And so I'll jump in and just say that we're learning, we're in the learning phase. So we're really listening to all of our stakeholders and having them tell us what resonates with them. So we're hearing, this is a public good. This is an economic imperative. We need our employees to come back to work. Business leaders are saying, we want to be a part of this conversation. We want to help in some way. This is not something that we can rely on government to do. So we're engaging business leaders and they're interested. The philanthropic support, as I said, is really small, but we're getting more and more interest. And so I think we just need to keep having the conversations and saying, we're going to have to raise revenues somehow. And it's not, we wouldn't be an anomaly in Montgomery County. We would be part of a larger movement at state level and national level of trying to find this money.
Great. Thank you all. And so my next question is for Bruno, and you started to touch on this a little bit in your introduction. What are some of the most sustainable ways that the federal government could step in and help fund early child education so it doesn't all fall to individual states and counties to figure out where that money's coming from?
Well, I mean, they can deficit spend, so they could just appropriate. They could do it right now. If Congress had the political will, they could just spend the money and send it to the states if they wanted to, right? Which essentially was what Build Back Better would have done had they've been able to get over the hurdle. So that doesn't seem to be on the table. As I mentioned, I think realistically, talk to your Congress people, your representatives, obviously, and tell them this is important to you. But I think we're really looking at deep tax cuts, which are going to make revenue and spending fights more difficult over the next decade. So I think that's just something that advocates need to be clear-eyed about, honestly. Not to say to give up the fight, but like it's a very real possibility that it's just going to be tough to ask the feds for more money than it has been recently.
Great. And Ashley, kind of sticking on that theme of finding sustainable ways to fund early childhood education, and looking at other states, maybe comparing them to Maryland, what are some of the funding mechanisms that you think would work best for the state or districts individually when it comes to governments gathering that money and distributing it? Like, what are the best example policies that would work really well here for raising that revenue?
Thanks, Maya. I think Bruno touched on this a little bit earlier too, but really ballot measures. Our team has seen a lot of success with mostly localities taking childcare straight to the ballot. Even last month, there was a really big win in Travis County, Texas. They were able to look at their current reimbursement rates for childcare, and then they had a proposed higher rate. They showed the difference between the daily rates between age groups, the yearly difference, and then again, they had this number in the back of their head of how much money they needed to raise in order to really fund childcare slots. Again, this was up to 85% of that state median income. But they took this to the ballot measure. It increased a property tax there, but they were able to expand childcare slots, provide more scholarships. And so again, I know that I think there is really this like want of the federal government to really step in, but I think a lot of the success that we're seeing specifically for early childhood is coming from the local level.
Great. And then Brittany, you touched a bit on what your organization does in your introduction, but I wanted to ask about specifically how Montgomery County is prioritizing closing equity gaps, opportunity gaps when it comes to distributing money and investing in early childhood education. How are you keeping that top of mind and making sure those dollars get distributed in the most equitable ways possible?
Thank you so much, Maya. I would say first, we've had the opportunity to distribute $1 million that the county council allocated to us to help with increasing community seats for pre-K. And so what we did was really worked with providers to write their grants for the pre-K expansion grant, to do some back office, business support that they needed. And we were able to expand the community-based seats by 120 this year. And so we're really doing our best to really step in and provide the support that's necessary. This was in partnership with the Family Child Care Alliance of Maryland and also Maryland State Child Care Association.
Great. And Brittany just brought up a great point about pre-K, which we mentioned earlier. This evening is kind of where the state has put a really big push when it comes to expanding childcare access, has been on expanding pre-K, adding pre-K seats, upping eligibility for public pre-K. And so I wanted to hear from each of you on where you think similar investments should go at the younger levels. So how do we kind of see this push we've gotten behind pre-K, which has seemed popular, parents are excited about it? How do we get that to trickle down to lower levels and get younger kids into some kind of care, even if it's not a formal classroom, the way that we think of preschool? And anyone can start, whoever's ready.
Well, I mean, I just want to give a shout out to one of our partners, Jennifer Arnaiz, who's on the call. She and her department in the Early Care and Education Initiative really focused on EquiCare grants this year, which increased funding for seats for infants and toddlers. And so we're recognizing that huge discrepancy, especially with the supply and demand. cost study that was recently completed and the cost of quality care study, and just really seeing that need. So I want to give a shout out to them.
Maya, can I ask if Brittany is if you can check your mic, your sound is really low, just in case you end up talking again.
Yep, can you guys hear me? Is it better now?
Yeah, that's better. Thank you.
Okay, great.
I have a quick response to that question. I'm not an expert on policy in this area, by the way. The only expertise I have is on work requirements and public assistance programs other than state income tax or state tax policy. But I do think, from what I understand, one of the big barriers is the costs for infants and toddlers are much higher given the reasonable difference in ratios of staff to, children. And so I think that also, again, not to sound like a broken record here, but it just speaks to the importance of like taking on these revenue fights, and also how important it is to do it at every level, right? Like city, county, state, like it's an all hands on deck situation, I think.
Ashley, did you have something to add?
I was going to add another just comment to this. So our state fiscal map, as well as the local ones, again, are looking at 0 to 24, but a big piece of that is being able to zoom in on specific ages. So some states early childhood 0 to 8, some places it's 0 to 5. So being able to pick out the specific funding streams that are available for each of those age ranges. And then again, when we're saying 0 to 24, another big area that really does lack funding is we track funds that are available for prenatal and maternal health. And every time we do this visual, that is the least funded, really, no matter where it is. So just want to also throw that out there, that's a big area that still definitely needs attention in this funding space.
Yeah, and to kind of close out the panel, when we're talking about funding, I think we often think about funding as top level, going to fund programs, going to fund organizations, looking at this as a policy lever that we're funding. But something that we've seen come up actually initially through direct ballot initiatives, like we were talking about before, is the idea of getting money directly into the hands of parents as a solution and funding families directly. And I was wondering what each of you thought about that as a mechanism in addition to funding policies, if we were to give money directly to families, if any of you have studied how that works in practice and if that helps with childcare accessibility and affordability.
Heck yeah. I mean, personally, for sure. I couldn't tell you that a great share of like the fully refundable child tax credit that we experienced briefly, for instance, really went to childcare providers. But in my view, looking at like the whole family, the whole child, all of these supports matter, right? Whether it's like SNAP, Medicaid, all these things. And so, yeah, giving money directly to families makes sense. And I also personally think it's just, right? Like, I mean, being a parent's hard. It's societally beneficial. Why not pay them to do it?
Now, I've not personally researched anything around that, but I do think it's a good idea also. And families, more than half in Montgomery County are living below the self-sufficiency standard. These are families with very young children and they can't afford basic necessities. So I agree with Bruno that, SNAP, TANF, WIC, Healthy Babies programs, prevention really helps families with a great start. And I think we look at the system holistically. So all of the supports and services, not just early literacy, infants and toddler seats, not just pre-K, but the health and mental health and overall well-being of the entire family.
And Ashley, did you have anything to add on to that?
Nope. No, I agree with Bruno and Britt. I think it provides a level of stability for these families. Like maybe they're moving, they're going to a new county, a new child care center. Giving families this level of stability, I think, is always just a great policy.
Great. And I think we're about to move into our Q&A session for all of the panelists, but we have like another 30-ish seconds on this panel. So I wanted to circle back because this was probably the most complicated of the panels in terms of what we were discussing, to see if any of you had anything that you wanted to add or clarify for the audience.
just to reiterate that I really think the issue here is political will, right? Like there's a lot of good ideas here. I'll personally help you walk through the specific taxes that you would need to raise to do it. I think really it's building the public will to convince the the politicians, to do it. And so I leave that in your capable hands, I think.
Great. Well, I think we're going to now move. We have some time for Q&A from the audience for all of the panelists. And I'm just going to get the questions here. I think Levante has questions for us. Levante, it's not letting me respond in the chat, but you could just ask them out loud if you want to, or you can feed them here. Oh, I have them. Okay. So our first is many faith-based institutions have available seats for early childhood education, and many are located in the neighborhoods where parents need the most help. Is anyone looking at that? So I guess that would go to anybody who can speak to private providers in the childcare market. Is anybody looking into how to incorporate faith-based institutions? I'm going to throw that to Christina to start because I think she'd probably have the most there.
So faith-based and religious programs can participate in the public pre-K application process. And we do have actually in Montgomery County a faith-based program that is participating as a public pre-K and has been for the last 5 or 6 years. So it's open to everyone. During the 6.5 hours of public pre-K, you cannot participate in religious activities, but you can before and after school, before and after that time slots. But certainly it's open to everyone. So if there's eligibility of those children, as the question was asked, that we definitely have opportunities for you to participate. I know the Children's Opportunity Alliance is on here, and again, working with programs to help them with these grants and applications to get more people to the table for mixed delivery, and certainly religious-based programs would qualify.
And then I think Danny had something to add to that as well.
Yeah, I just wanted to say one interesting thing we noticed in our analysis was within center-based care, we're seeing an increase in childcare centers that are sort of embedded within schools, religious organizations, nonprofits, while we're seeing a decline in businesses that solely provide childcare, which I just think is interesting, given that from my research, I understand that, one of the key challenges with like financial sustainability is sort of lack of shared services, economies of scale, et cetera. So it just at least seems to me to make some common sense that this would be the trend, because, if you're already set up as an organization that might have a little bit more like capacity for HR or, administrative functions, you can probably cut costs a little bit and provide care. That is just outside the scope of this report, but the trend we found, and then I'm just like, just my own thoughts of sort of why this might be.
Great. And did any of the panelists have anything to add before we move on to the next question? Great. Okay. And so the next question is, does the state offer any early childhood education incentives so that we can entice university students to choose this major? Go ahead, Jennifer.
Yep.
Looks like
the state does offer a childcare scholarships basically to go to pursue higher education. And so individuals can pursue degrees, whether it's an AA to a BA, and now master's in early care and education. And in addition, Montgomery County, actually, we have also funded through our early care and education initiative, additional funding for individuals to start at Montgomery College and then transfer to a 4-year institute. With really the idea of looking at non-credit classes. Again, as a reminder, we're so diverse in Montgomery County, so English is a second language. Being able to pay for many of those classes that are, prior to credit, right, and foundational courses in math and English. Again, also recognizing that many of our in the workforce have been out of high school for a while, and so going back into the college campus and pursuing those courses.
And I would just add that the Child Care Career and Professional Development Fund that Jennifer was talking about is a statewide initiative, very unique to Maryland, and it does pay full tuition and books it can be fully online as well, as Montgomery College has fully online. And it is the payback is that you have to provide service hours for depending on how long you're in school. So if it's a 2-year degree, you give back for the 2 years, and it has to be a minimum of 20 hours per week into a licensed childcare program. So we're really proud of that program here. And so there is some incentives to expand the workforce and provide that education.
But I do want to caveat that these scholarships are for those who are currently in the workforce. So it's moving individuals up the ladder. In terms of enticing individuals into the field of early care and education, there is work that is done through the high schools as well, following career tracks that would provide child development associates and then transfer credits into college, community college.
And then just don't want to take too much time, but there's apprenticeship programs as well through the Department of Labor that is very, this administration, the Moore administration is, again, and enough grants will be really working towards the apprenticeship model as well. So there are some enticements to that.
Albert, I had seen your hand up. Were you going to add something as well?
I was going to talk about the high school track through career technical education that helps younger people to think about this as a career and get them some training and credit hours and sometimes a CDA, the credential.
Great. And it looked like Danny had something to add.
I was just gonna say, I thought it was interesting in our research. Surprisingly, it seems that the turnover rate is less of the issue as just sort of backfilling the nationally like 20,000. Sorry, I forget the national number, but backfilling all the workers that left at the onset of the pandemic. So this like pipeline development, I think that distinction is important, like keeping workers in and moving them up the ladder versus getting them in the first place, especially when other jobs that require a lot less training and professional development are paying almost as much. We heard a lot about, Target, Amazon warehousing, et cetera. So I think that's a really important point.
Great. I think we are just about at the end of our time. Oh, we have a minute. Okay, so we're gonna do one last question and we're gonna make it fast. So are there other examples besides Washington State that get the money needed for childcare from employers and businesses?
Technically, the Vermont payroll tax that was mentioned, three-fourths of that falls on the employer. So most of that comes from the employer side. That's off the top of my head. Oregon has a corporate activity tax that also goes to education. I'm not sure if it goes to early education. I think it does. Those are the two that are coming to mind off the top of my head. I can get a more full answer to that via email, maybe.
I believe Michigan does too for just their state employees. They have a tri-share program. They split the cost through the state, the employer, and then the employee themselves, just as another example.
Great. So we are at the end of our time with all of our wonderful panelists. I want to thank all of you so much for sharing so much expertise and packing it into an hour and a half. I am so happy I was able to be here this evening with all of you, and I'm going to turn it back over to our organizers to close out the event.
Okay, I'm closing out. I'm Cynthia Rubenstein. I'm the chair of the advocacy committee, along with Diana Conway as the co-chair and Joanne Corvos as another co-chair. I want to thank Maya for being our moderator tonight. I read your stuff in the banner. And I want to thank our enlightening and all-star speakers tonight. This was a really enlightening, enriching discussion, and I'm sure it's going to stimulate a lot of thoughts and work on our advocacy committee as we get ready for the next session in Annapolis. And lastly, and mostly, I want to thank Kate Stein and Karen Finn, who are our Children and Youth Subcommittee co-chairs. And in their interest, I would like to invite any of the attendees, if you're interested in knowing more about WDC's Children and Youth Subcommittee, Kate and Karen are going to put their emails in the chat. And please feel free to contact them. They would love to have more talent and commitment on this subcommittee because it is a very, very important topic for WDC. and for the upcoming session. So this is closing it out. Thank you, everybody, for being part of this evening's discussion. And we hope to be able to tap our experts again, because you brought so many great facts and thoughts and ideas to our group tonight. So thanks very much, everybody. Have a great rest of your evening.
Good night, everyone.
Thank you.
Thank you. Excellent job. Thank you.
you.